briefly tell you a story. We know that your time is valuable, and I want to go ahead and thank the media for their presence here, because this is during a holiday week, and there are probably many other things that you could do. But there are many things that we see that we have to fight for, no matter what time of year it is. So to begin to tell the story of who we are, who this wonderful clinic is, what the 25 years means, is a volunteer, someone who does not have to be here, but has been a very able leader of this board, and we ask Chairman Farmer, the chairman of the board, to come forward now. Thank you, Chairman.
My name is Neil Farmer. I am chairman of the board for Central Care. This is the 25th year, as it's been pointed out, for Central Care, the first federally qualified health clinic in Houston. We have more than 1 million people in the service area, and in the 25 years here, we've served more than 300,000 people. We provide affordable and accessible health care services to the poorest areas of Houston. These services are medical, dental, behavioral, hepatitis C, HIV care and prevention, and we give free mammograms and early screening for early detection. We specifically target low-income and underinsured populations in the city. We feel like we have the proper score to maintain our facility, and we are shocked as to why we didn't receive more funding. We have helped the community recover from so many things. We have helped some people we've never heard about because we've helped them prevent problems, health issues, things like that. And I just want you to know in closing, Houston, Central Care has a problem. And if it's Central Care's problem, that's part of Houston's problem as well. And as a former sports writer, or as I say, a recovering sports writer, we're standing on third base in this era of the Astros and their great win recently, and we've not been given the chance to try to bring it all home. That's what we're asking for. Thank you.
Chairman Farmer is somewhat modest. He's a real sportsman, and so I'm going to re-emphasize, if you want the feeling that everybody had when we won the World Series, help us be victorious in keeping this clinic. We've got the power to do it. We've got the know-how, and the World Series feeling was so good, I can't imagine we don't want to have it again. But let's get it again. Our patients are extremely important to us, and so we'd like to have Ruby Samuel and Anaya Gonzalez come forward and tell their story about being patient.
And of course was thrilled that a clinic was coming to our immediate area. I live in Windsor Village subdivision. It's very important for me that I have a good doctor, well qualified, very personable, that I can communicate with. Communication is key when you are having medical issues. And part of my story is that when I was 34 years old, I had an intracranial aneurysm in my brain, called a stroke very often. I was sitting in a meeting, and before I knew it, I was becoming paralyzed on my left side. I was able to continue speaking. I was working at MD Anderson Hospital. And I'll just say that and move on. I came to learn that I was in one of the best institutions for cancer treatment, but not the location for treatment of an intracranial aneurysm. So I had to be transported. Thank God I'm standing here. The only effect that you can see is if I tell you, which I do like to share with people for the simple reason that my story can help someone else. I had gone through a number of years of headaches, didn't know the origin, had seen more doctors than you would imagine, even a psychiatrist who asked me why was I there. Came to find out that it was the bleeding, the slow bleeding of that blood vessel. Now it has become very important to me since that time that I have healthcare management that is delivered in such a way that prayerfully I can avoid another, and it is very prevalent in my family. So when I walked into Central Care, let me tell you, the day that I went there, my blood pressure was triple digits, both systolic and diastolic. I had a headache that I'd had for a few days. My daughter and I went to another clinic. I sat there for 2.5 hours and was never seen. My daughter
Ms. Gonzalez will come forward, and then she'll do some in Spanish. Ms. Gonzalez, thank you so very much.
Hi, my name is Anaí Gonzalez. I've been a patient of Central Care for a few months now. My family has been a patient of Central Care starting last year. We were so delighted to know that Central Care does offer both medical, dental, and even more services that we have not yet utilized. But as for myself, I have been a patient at their dental facility here at the 3rd Ward area. It's very convenient when it comes to getting appointments, especially whenever you have that really bad toothache that, you know, not anyone is gonna treat. So that was my experience. As soon as I walked in through the door, you can see and feel the presence of Central Care employees, always being welcoming to you. Coming from a Hispanic family, mainly immigrants, it's nice to know that everybody is very welcoming. Sorry. So just a few words in Spanish. Mi familia.
We wanted to tell you a story. We'd like to ask Dr. Kimberly Butler and Ms. Marquita R. Casely Hayford to come forward as well, together, if they would. Thank you. We're not making this up. Thank you, Dr. Butler. Thank you.
Thank you. Thank you. I'm Dr. Kimberly Butler. I'm the Chief Medical Officer at Central Care Integrated Health Services. There are two things that I'm going to say. One is individually, to whom much is given, much is required. That means every employee here has been given the opportunity to make an impact on the community. Therefore, it's a requirement for them to fulfill their destiny. In order to do that, they must do what they've been called to do. Collectively, as a company, to whom much has been given, much is required. We have been given the opportunity to serve communities all across the city of Houston. Vital. Your health care starts when you walk in the door and say, I have an appointment or I need an appointment. Central Care ensures that everyone from the front to the back takes on that responsibility of providing good health care, excellent health care to the community. Let's put it this way, since we're in the home of the Astros, World Series winners. Let's imagine a baseball game. You're up to bat. But you know what? You have a bat. You're up to bat. You know what's keeping you from batting? Hypertension, diabetes, thyroid disease, cancer, breast cancer, prostate cancer, stroke, vision loss, poor dental care, teeth falling out, hair falling out, but knees giving out. We're in all of this together, right? You can't bat, but you know what? The world keeps throwing you those balls. They keep throwing them. You keep missing. You don't have anything to hit it with. But if anybody knows anything about baseball, there's a rule where you can have your third strike, but if the catcher drops the ball,
Go ahead.
you have a chance to run. Right. Central Care does its best to give you the bat, but just in case you don't get that bat, that's that preventative health care, medication for the hypertension, diabetes, thyroid disease, mammograms for the women, prostate cancer screenings. Just in case you don't get that, when they throw that last strike to you and you miss, Central Care is the one who ensures that when they drop that bat, they're directing you to first base. When you get to first base, they're giving you that preventive care you need. And when you get that preventive care, we do what? We get stronger. That means you can go to work, you can apply for a job, you can do well at school. So then you make it to second base. When you get to second base, now